Pretty much everybody you've seen talk this morning is available to answer questions on cases. And this first one is, I believe, yours, Peter. So you want to walk us through this?
Yeah. So this is your, it was my worst nightmare. Beautiful 10-year-old girl walks into my office with a draining ear. She's looking down. She won't look at me. She hates going to the doctor. She's been getting her cavity cleaned once a month, hour drive each way to go get her cavity cleaned. She has a history of 2 mastoidectomies beginning 3 years prior to my seeing her. First surgery, she had a complete facial paralysis. Her second surgery, she developed, again, a worsening facial paralysis. She comes in with a draining ear, a very small meatus. When you go into look into cavity, there's tons and tons of squamous debris. It had just been cleaned 2 weeks earlier. She's a House Brackman 3, again, lives in a very remote area, has these really long trips to come get herself cleaned up. Here's her audiogram. Her right ear is okay. She's got a mixed hearing loss in her left ear with, severe, with the conductive component. So
I moved your pictures around into one slide.
Yeah, that's okay. Yeah. I don't have a laser here, but anyway, so this is a great slide for looking at potential complications of cholesteatoma. So I think it misses maybe one. I don't think there's an intracranial abscess, and I think her sigmoid sinus actually had flow in it. That's about it. So when you look at this, it's a huge area. Facial nerve, it's in the recess. As you come further down, you start going, wow, isn't there supposed to be bone here? Yeah, there is, and there's not. We see this is the end of the IEC, so what's coming out of here, the facial nerve. Here's part of the lateral canal that's dissolved. And again, there's a connection now from where this cholesteatoma is really to the IEC. So we know her facial nerve is floating around in there somewhere because her nerve's been bagged a couple of times, and we see a big open exposed area here. So next slide. MRI, I don't know, it's worse if you ask me, but I didn't see any there was no brain involvement with this. So the question is how do you handle this kind of a patient? You've got someone with a little girl with a known facial nerve problem. She still, quote, has hearing, but she's got this huge cholesteatoma. It's a huge social issue. Well, for me, this became a question.